Great. Thank you very much. So I will just share my presentation with you guys. Yes, hello, and thank you very much for attending this lecture. So in the next 45 minutes, I'll talk you through lower urinary tract disease in dogs and cats. And to kick off the presentation a little bit interactively, I'm actually going to hand back over to Dr. Vachel because we are starting with a question. Dr. Vachel, over to you.
Yeah, thank you, Esther. So, guys, as you know that we will ask certain questions which will appear just below the chat box on your screen. You will get 4 options, and you just need to enter the correct, most appropriate answer, and we will and the speaker particularly will clarify your queries or questions. Whatever queries or questions you have, you can drop it into the chat box so that at the end speaker can answer it. So if the first question is, what is the percentage particularly of prevalence of lower urinary tract diseases in case of cats? And your options are whether it is less than 1%, whether it is 1 to 3%, whether it is 3 to 5%, or is it less than 5%. You will get 30 seconds to answer it, and this is really a straightforward question, that what is the actually prevalence percentage in case of a lower urinary tract in cats. Over to Esther.
Yes, so well, you're probably thinking back, how many of these cases do I see on a daily basis? And I'm not. It's actually not visible to me to what you guys are saying, but just to start talking you through the literature right now, there are quite a few studies out there now that have assessed the prevalence of lower urinary tract disease in cats in primary care practice in certain locations. And one study from Dan O'Neill, which was published in 2014, looked at the prevalence of these diseases in cats in the United Kingdom and showed a prevalence of 4.4%. There is a similar study that has been done on US data, which showed a prevalence of 5%. So in this case, the correct answer would be 3 to 5% for the prevalence of lower urinary tract disease in cats. So that's really high. That's one in 20 patients that you see in your practice. And the next question is the same, actually. The same question, but for dogs. So over to you again, Dr. Vachel.
Thank you for such a wonderful clarification. So again, the same question, but only in case of dogs here we are asking. So what is the percentage of a prevalence of a lower urinary tract diseases in case of dogs? And your options are again same. It is less than 1%, it is 1 to 3%, or is it 3 to 5%, or it is more than 5%. So you just need to just select whatever you feel appropriate, and Esther will try to answer it. Yeah, over to Esther.
Yeah, so again, here there are similar studies available as there are for cats. And I think one of the really interesting things that might have also popped in to your brain right now is that there is a huge variation between breeds of dogs and sex. So you probably know that certain small breed dogs are more likely to get urinary tract disease. You're also probably aware that female dogs are more likely to suffer from urinary incontinence. So in this case, overall, over the entire dog population, the correct answer is actually the same as it is for cats, 3 to 5%. There's a big study that was done with purebred dogs in the UK again, which showed a prevalence of 3.75%. And this data was obtained from pet owners using a questionnaire. But there are certain dog breeds where the prevalence in the breed in particular is really high. For example, female Rottweilers have a high prevalence of urinary tract disease of 3.6%. And this is also where the sex difference comes in, because in males, the prevalence is only 1.4%. So overall for dogs, also 1 in 20 dogs coming to your practice might suffer from lower urinary tract disease. So let's get over to the clinical what are the clinical signs of lower urinary tract disease? Frequent urination, painful urination, blood that you can either see in the urine or microhematuria, and of course, urination outside the litter box or urination in inappropriate places. So here on the right-hand side, you can see that this cat here is straining. The cat has blood next to the litter box. And on the left-hand side is a video, but we forgot to test it. Yes, you can see it here. This dog is trying to urinate, but is actually not managing to get very much urine out. And because we don't have very much time to go through every single question that I actually want to ask you, I just want to keep it semi-interactive by letting you think about these questions yourself and by, if you want, answering them in the chat box. Think to other cats that you're seeing in your practice. What is the most common urinary disease that you see in cats? Are cats typically urinating outside the litter box or on the bed of the pet owner, or do cats have blood in their urine most typically because of stone disease, or is it a different disease that you see very frequently? And the same question, again, you can take it to the chat box. What is the most common urinary disease in dogs? So again, you think back probably to stone disease straight away, because this is a lecture organized by Royal Canin. But are there any other diseases in dogs that you actually see really regularly, and which ones would those be? And keep the sex difference in mind here as well. So are certain diseases very specific to female dogs, and would you not see them in male dogs, or vice versa? I'm going to just give you a few seconds to think about this and reflect on this, and then I'm going to take you to the next slide, on which I could show you a summary of all the published literature that we currently have, and with which I've tried to estimate the prevalence of the most common urinary diseases in dogs and cats. So here we have the visual, and I'm sure that many of you in cats thought about feline idiopathic cystitis or feline interstitial cystitis, or FIC. It's the most common urinary tract disease in cats, with approximately estimated on the literature 57% of the lower urinary tract disease causes in cats being for that reason. And in cats, stones take a huge part in the disease. Urolithiasis accounts for about 22% of cat lower urinary tract diseases, and urethral plugs, which in a way would fall under urolithiasis because often struvite is involved, in a way fall under feline idiopathic cystitis because often the two are connected, but I separated them out. The blocked male cat is 10% of these cases. In urinary tract infections, 8% are more common in older cats that have lower urine concentrating abilities. In dogs, the biggest cause of urinary tract disease is actually bacterial cystitis, so urinary tract infections. And incontinence is another really big chunk of that, 24%. And like in cats, about 1 in 5 of the cases is due to urolithiasis. So I want to focus a little bit more on urolithiasis in particular now, because out of all these diseases, urolithiasis is the disease with the greatest impact on dogs and cats. And why am I saying this? It's because these diseases very often go undiagnosed for a very long time, and they can actually turn into a life-threatening situation. For example, if there's a blockage, if there's a nephrolith that gets blocked on the way to the bladder, or if there's a blockage in particular in male animals. So urolithiasis, despite being only 1 in 5 of lower urinary tract disease causes, is actually the one that could have the greatest impact in the pet overall. And what is the most commonly diagnosed urolith in dogs? And of course, I'm going to ask you the same question for cats. You can give these answers again in the chat box. And it's just for your own reflection on this and to keep your mind a little bit active. Obviously, I will be talking you through the literature. And I think the most important thing to realize is that the answer to this is not necessarily the same as it was 10 years ago. And there are changes over time in what the most commonly diagnosed urolith is in both dogs in cats. So let's have a look at the literature here, and it might be helpful if I get my laser pointer out for this because there's a lot of graphs. So let's start with this first graph that we have over here in cats. In black on this graph, you can see calcium oxalate, and in white on this graph, you can see the struvite stones. And the other colors on the graph represent the other stones, such as purine stones or mixed stones. And you can see that back in the 80s, struvite stones were the main urinary tract stone in cats, and calcium oxalate stones only accounted for a small part of them. But over time, the amount of calcium oxalate stones started increasing, and relatively, the number of struvite stones started decreasing. It's important to realize that all these graphs that I'm showing you is not the absolute number of stones. It's the relative number as opposed to each other. So it is possible that over time there's actually an increased awareness of stones, and the total number of stones that is being diagnosed is increasing. But relative to each other, struvite seems to be decreasing over time, and calcium oxalate seems to be increasing, or at least this is true for a study published in 2009. And we can see a similar pattern happening in another study from the US, where in white you can see the struvite stones being really the great chunk of stones that is being diagnosed back in the 80s. The calcium oxalate stones are starting to take over once we're entering closer to the millennium. For dogs, we've been seeing a very similar pattern. So again, here on the left, white is struvite, black is calcium oxalate, and in the other colors you can see other stones such as purine stones and cysteine stones. And relatively, you can see a decrease happening in struvite stones over the years and an increase in calcium oxalate stones. And the same in this study over here. So again, in this study, you can see in black the struvite stones and in white the calcium oxalate stones. So that's a reverse from the study above, unfortunately in colors. And again, over here, you can see that over time, calcium oxalate stones are starting to gain traction in a way. Now, more recent studies can start to see shifts in this pattern again. So let's look at this again. This is a study from Canada, again in cats, showing a very similar thing what we talked about just now. But this is a recent study just published early this year from the US. And what you can see here is in black the calcium oxalate stones and in gray the struvite stones. And over time, approaching 2016, 2017, and 2018, you can start seeing the struvite stones taking the overhand again in cats. So in cats, it was struvite stones a lot in the 80s, calcium oxalate stones started to pick up in the millennium, and now struvite stones start to be taking the overhand again in cats. In dogs, this doesn't necessarily seem to be the case. So this is a graph over here that you can see for dogs. And in dogs, it seems to sort of be stabilizing around the 50-50 mark at this point in time. And yet again, it's a lot of graphs, so I'm not going to go through this one in detail, but you can see a similar pattern happening here in this study in the Netherlands, where calcium oxalate stones are represented in gray, struvite stones are represented in black, and in dogs, you can see a gradual decrease in the struvite stones, but actually balancing out with the number of calcium oxalate stones that is being diagnosed. So why do these stones in crystals form? It really depends on the stone type or the crystal type. And overall, I'd say that there are three big factors that play a role. It's genetics, the environment, and certain diseases or infections. So for example, in struvite stones, a urinary tract infection can play a very important role. And overall, these genetics, the environment, and these diseases or infections cause a supersaturation of the urine with the precursor of the particular stone and crystal that we're talking about. And at Royal Canin or in R&D, I must admit that I'm pretty obsessed in assessing stone risk in nutrition. And why am I in R&D obsessed with this? This is actually dating back to a brilliant physiologist who was also a lawyer. He had very many qualities back from 1825, Jean-Pierre Savarin. And he said, dis-moi ce que tu manges, je te dirai ce que tu es. And I'm happy that you guys aren't French because I'm not either, and my accent is horrible. But basically what he said is, tell me what you eat and I will tell you what you are. Pets eat the same food day in, day out. It's not varied at all like it is in humans. And we can sometimes have the occasional McDonald's or the occasional Haribo sweets. Pets, they eat a less varied diet, and they cannot afford for this diet to not be complete, to not be balanced, and to not be safe. We need to ensure, as pet food companies, the diets are complete, balanced, and safe. And we try to predict the real world situation in these pets and what effect this diet has on them using controlled research studies. And relative supersaturation of the urine guides the formulation of all the diets at Royal Canin. So how would we assess stone risk? You all have experience on how to assess stone risk clinically. You take the history, you think about the breed of the pet, the age, the urine pH, the urine specific gravity. But in research settings, we can only assess healthy animals. We don't have animals that have stones. But that does mean that we can assess one thing at a time and investigate how little changes in the diet affect concentration of solvents in the urine via, for example, urine dilution or the precursors of these particular stones in the nutrition, and how these all interact with each other, which of course is influenced by the urine pH. And these factors, the concentrations of the solvents and the interaction between the solvents, is what we call relative supersaturation. And it's quite a difficult concept. So I want to spend a little bit of time on this, but I'm going to try and do it in a fun way. So here you can see the different states of saturation. So let's first think of an unsaturated solution. You have your cup of tea and you're going to be adding sugar. The sugar will dissolve because the cup of tea initially was unsaturated and will continue to dissolve the additional solute that you're adding. When you talk about a saturated solution, it cannot dissolve more solute. So any added solute will float or it will sink undissolved into the solution. So think of this glass of iced tea. If you add sugar to the sweetened iced tea, it won't dissolve anymore. There's enough sugar in there anymore. Instead, it will settle to the bottom of your sweetened iced tea. And then think about a supersaturated solution. A supersaturated solution contains more dissolved solute than a saturated solution. Often though, because of changes in properties, such as an increased temperature, you are not actually noticing this at the time. And adding more solute or changing other properties, such as cooling of the solution, may cause precipitation. This is something that you might see regularly in your clinic. You take a urine sample, you look at it under the microscope straight away, it's clean. You take a urine sample and you look at it under the microscope 2 hours later, and you can see struvite crystals. That's because you change the environment of the sample, and maybe the urine was already supersaturated, but it wasn't allowing for these crystals to form yet until this change in the situation occurred. So I try to represent the supersaturated solution here with a can of Coke. Carbon dioxide is added to this at a very high pressure. And after that, the can is closed. So nothing is happening there when the can is closed. But when you open it, the CO2 bubbles will release to the surface and you can hear a psh. And this shows that actually the solution was supersaturated with the carbon dioxide. So the RSS definition, other than relative supersaturation, the numerical result is a ratio of the amount of dissolved soup substance, and supersaturation would mean that the dissolved substance exceeds the normal capacity. RSS definition could easily be interpreted as the potential of the urine to form crystals. And in a way, it provides a comparison between the activity product and the solubility product of the different compounds that are in the urine in a given solution. So how do we measure RSS in feeding trials? First, we feed the particular food that we're interested in for 7 days, called the adaptation period, after which the animals are in individual lodges and we collect all their urine samples over the course of 3 days. All these urine samples are pooled together, and on this urine pool, using ionic chromatography, we will measure the different ions that are involved in urolithiasis. And after this, we have the concentrations of these ions, and we calculate the RSS value using a software package that involves an algorithm that was developed actually in the 1960s already. And on this slide, you can see a simple representation of the algorithm that we're using. So above the line here, you can see the activity products. The activity product is the different ions that play the biggest role in the formation of crystals. And this is called the formation product if the activity product reaches the point at which it induces crystallization. So the formation product is the highest concentration of a solute in a solution before precipitation occurs. The solubility product is the level at which a solute dissolves in the solution. And the higher the solubility product, or the KSP, the more soluble the certain substance is. And a value under 1 for this calculation means that the urine is undersaturated. If it is 1 exactly, it's saturated. So you have your sweetened iced tea, and over 1, it's supersaturated. So you have your can of Coke and the carbon dioxide. So what does it mean? I like to give it away a little bit in colors. So if you have an undersaturated urine, then you're in the treatment and prevention zone. It's called, the undersaturated zone, and it's a value below 1, and struvite will dissolve. When you are in a metastable supersaturation zone, which for calcium oxalate lies between 1 and 12, and for struvite between 1 and 2.5, and that indicates that the concentration of the solute is greater than the solubility product, but less than the formation product. So crystallization may occur, but only if other factors are present. And then we can enter the danger zone, labile supersaturation, with the calcium oxalate RSS value over 12 or struvite RSS value over 2.5. And in this case, spontaneous crystallization is highly likely to occur. And here I'm giving it away with an arrow as well. So remember, in metastable supersaturation, not much will happen because the activity product is still greater than the solubility product, but is below the formation product. But if other factors are present, then crystallization might occur. So there are a lot of animations on this slide, and I'm going to talk through them because otherwise it's going to be a very busy table. But I just want to reflect on these zones of saturation in a slightly different way again. If you are in the undersaturated zone, new struvite uroliths will not form, neither will calcium oxalate uroliths, and existing struvite uroliths will dissolve if an existing bacterial urinary tract infection that might play a role is also treated at the same time. Existing calcium oxalate uroliths won't grow when the urine is undersaturated, but unfortunately to this date, we do not know how to dissolve calcium oxalate. In a metastable supersaturation zone, new struvite uroliths won't form, and neither will calcium oxalate, but if there is an existing struvite urolith, it won't dissolve and it might grow. And the same is true for calcium oxalate. And then we have the danger zone. Stones might form if the urine is supersaturated. So again, a little reflection slide to get you back to it, because I've been talking for a while now. How can we influence RSS with nutrition? What can we do to make sure that we are in the right zone of supersaturation that we want to be in? You can answer again in the chat box. You can reflect on it by yourself, and I'm going to talk you through it in the following slides. So ways to decrease RSS. The first way to decrease RSS is very simple. Decrease the concentration of precursors in the urine, which means that you want to go from a situation where you have very many of these precursors to less per milliliter of urine. And it's very simple, really, how you would do that. You can either dilute the urine, so you would want to increase the water intake, or you will want to limit the amount excreted of these concentrations by modifying the diet accordingly. Then a second thing that you can do to decrease RSS is to modify the chemical form of precursors in the urine. And you can do this by controlling the urinary pH. So don't worry, we're going to talk about this in more detail straight away. The first way to decrease the RSS, well, in general, the more dilute the urine, the lower the RSS. And there are 3 ways to do this. The first way to do that is to feed a diet that is more than 73% moisture. So you can either give wet food or you can add water to dry food. The second thing that you can do is making the water more attractive. So you can think about flavors that you can add to the water, giving a water fountain to stimulate drinking, particularly works in cats. And the third way to increase water intake would be to feed a high sodium diet. And by increasing the water intake, increasing the urine volume, you will decrease the urine specific gravity and decrease calcium, oxalate, and struvite RSS. So a wet food typically is over the 73% of moisture that I just said is needed to dilute the urine. So if you feed a wet food exclusively, then you're good to go. You will be diluting the urine directly. But what if you have an animal that doesn't want to just eat the wet diet exclusively, or the owner wants to offer a more varied diet? Well, an easy way to remember, I find, is that you can say, okay, in order to dilute the urine, you want to give 1 cup of kibbles, or the ratio of 1 cup of kibbles and 2 cups of water. So a cup of kibbles contains, depending on the type and brand, approximately 100 grams, of which about 92 grams is nutrients besides water, because every kibble will contain a certain amount of moisture. 1 cup of water contains 237 grams of water. So if you add 8 grams of moisture from the kibbles and 237 plus 237 grams of water from the cup, you get a total of 482 grams of water and 92 grams of nutrients in this 482 grams of water. Means that the diet will be 84% water. So then you're definitely reaching your threshold for urine dilution. So that's an easy ratio to remember, 1 versus 2, in order to dilute the urine with an increased water intake. So what does this actually practically do for struvite RSS? So in this slide, you can see a study that was performed in cats. This is where the 73.3% comes from that I just reflected on. In the first increases in moisture, so if you offered cats a diet of 25% moisture or 53% moisture, actually what these cats were doing was adjusting their voluntary water intake. They were like, oh, I'm getting more water from my food. I don't have to drink as much anymore. And that meant that they had a stable water intake. And it was only from 73% moisture in the diet that this was sort of overruled, because the total water intake that they were taking in with the diet with this moisture level was more than they would normally naturally drink on a day anyway. And this was also the level of moisture that was associated with a lower struvite RSS, and this was statistically significant. For dogs, similar studies have been done. And over here, you can see that in dogs, a dietary moisture of 73% decreases the calcium oxalate RSS in dogs significantly. The calcium oxalate RSS for cats also significantly decreases with diets of 73% moisture. So feeding a wet food exclusively or adding water to the food means that you can already decrease RSS with any diet that you would basically be offering to the pet. But of course, there are also other nutritional solutions, right? Monkeys, for example, so those animals that just won't eat anything but kibbles. If you increase sodium in the diet, then you will increase the drinking and you actually increase the urine volume, decrease the USG, and you cause urine dilation. And on this slide, you can see a recent publication from 2020. And what you can see is that with an increasing sodium content in the diet, going from 0.7 grams per mcal to 3.3 grams per mcal, both in dogs and cats, you can see a gradual increase in water intake because the animals started drinking more in response. And actually what you could see in response to this increased water intake is that there was a gradual decrease in struvite RSS in both cats and in dogs, and this was statistically significant. And you can see the same happening for calcium oxalate RSS. So again, you can see this gradual decrease in calcium oxalate RSS and in both cats and in dogs with increasing sodium levels in diet. And in this study, the maximum level tested was 3.3 grams per mcal. So the other thing that we talked about was decreasing struvite RSS with targeted dietary minerals. So struvite contains of three different things: ammonium, magnesium, and phosphorus. And what we've actually shown indeed is that the risk factors for struvite stones are a high dietary phosphorus and a high dietary magnesium concentration, because both of them lead to increases in urinary magnesium excretion and urinary phosphate excretion, and they contribute directly to struvite formation. Unfortunately, calcium oxalate RSS is not as straightforward as struvite in targeted dietary minerals. This slide, therefore, is a little bit more of a mess than the previous one. So first of all, you think, okay, calcium, huge in calcium oxalate, right? So can I just decrease dietary calcium and decrease the risk? But no, because calcium binds oxalate in the gut. So if you decrease dietary calcium, and actually you increase oxalate absorption from the GI tract. And if you increase dietary calcium, because you're like, oh, maybe I should increase it then, because then maybe the oxalate won't get absorbed, then you get a higher urinary excretion of calcium. Then there are other nutrients that interact with calcium, such as phosphorus, right? Calcium to phosphorus ratio, vitamin D in the diet, fat contents of the diet, and also the source of calcium. Some protein sources, such as animal protein, have a different bioavailability than vegetable protein sources. So overall, we'd say that a moderate level of calcium is recommended. Dietary oxalate is even more confusing, unfortunately. There's no good correlation between intake and excretion of dietary oxalate. And there are also multiple precursors of dietary oxalate. Hydroxyproline, the part of what's a protein source that we can use in the diet, and vitamin C both contain lots of precursors of oxalate, which can then be produced in the liver. And the last one I wanted to touch on is urinary pH. So what urinary pH does specifically is have most effects on struvite RSS. So the lower the urinary pH, presented over here at the bottom, the less phosphate is free to bind magnesium and ammonium to make struvite and vice versa. So you can see that at a low urinary pH, the phosphate is bound to the hydrogen ions, and at a high urinary pH, those hydrogen ions are present, the phosphate is freely available to start binding up with magnesium and ammonium. And this has been tested in a study in which 30 cats were randomized to one of three diets for 2 weeks. And these diets, this study tried to figure out whether what was more important, actually, the urinary pH or the magnesium content of the diet. So both diets contained similar amounts of magnesium. This one contained 5% magnesium as fed, and this one contained the same amount. But this magnesium salt is acidifying, so urinary pH was 5.7, and this salt is alkalinizing, urinary pH is 7.7. And the basal control diet had low levels of magnesium and neutral urinary pH. And what you can see here is that despite the high magnesium concentration in the diet, with the alkaline urine pH, there was struvite crystalluria in every single cat that ate the diet, and one cat obstructed. However, in this diet with high magnesium but a low urinary pH, there were 0 cats with crystalluria. So this study figured out, and it's an old study from 1985, the year I was born, we already knew that basically magnesium was not as important as pH for struvite process. So over to the next slide, the clinical connection between RSS and what happens in your practice, because this is what you're most interested in, right? So this is actually, how would you call that, an ex vivo study, an in vitro dissolution test. What we did was we asked a stone lab to just send them all their struvite stones that they had recently. And we selected their stones that all had a similar shape and size. And we fed cats commercial dry diets that induced different urinary RSS results. Diet 2 in this study, here at the bottom, had an RSS value of 0.2, whereas diet 3 in this study, oh, so I'm sorry, I'm reflecting on this wrong, sorry, diet 3 in this study had an RSS value of 0.2, and diet 2 in this study had an RSS value of 0.4, sorry about that. I should have put it on the slide, would have been easier to remember for me. Dissolution happened whenever we put the stones that we got from the stone lab in these urine samples. Dissolution happened on both diets, whereas it didn't happen on a diet that was induced a struvite RSS that was really quite high. You see these stones, they remained exactly the same size and shape. Over the course of 24 days, these stones dissolved. But dissolution on the diet that had an RSS value of 0.2 was almost twice as fast as dissolution on the diet that had a struvite RSS value of 0.4. So message of this is dissolution will occur if you're below 1, but the lower you go, the faster it will be. And I'm presenting here another clinical connection slide to you. This is actually an in vivo study performed in 21 cats. And these cats were fed two diets, one diet with an RSS value of 0.2 and the other diet an RSS value of 0.3. And complete stone dissolution happened in 17 out of 21 cats on this study. The 4 other cats, they underwent surgery and their stone results came back as not being struvite. They had calcium oxalate or calcium phosphate stones. And the average time for stone dissolution was 18 days. So this is something I really want to focus on you with right now. Actually, it emotionally involves me a little bit as well, because the cat that I had at university, Frans, he recently had bladder stones, and his owner is my housemate, or was my housemate at university, and she's also a vet. And she saw he had bladder stones, and she went in with surgery straight away. She texted, "Frans has bladder stones, I'm going in." And I called her, I said, "Don't go in." She didn't pick up the phone. So an hour later, she called me back. She said, "You rang?" And I said, "Yeah, I just want to tell you, don't go in. Try a urinary diet first, because if it's struvite stones, then you can dissolve them, on average within 2 to 3 weeks." And she said, "Oh, too little, too late. I texted you just before I scrubbed up. I've removed them all. We had so many. And I'll send them off to a lab. We'll get it confirmed." And 2 days later, they came back. It was struvite. She did major abdominal surgery on a cat that I love a lot. Frans was recovering for a very long time afterwards, developed some anxiety, which isn't great for urinary disease anyway. He was hiding under the bed. He was in pain. She needed to administer pain medication, when the other thing she could have done was fed him a urinary diet that induced a low struvite RSS value, and within 2 to 3 weeks, the stones would have been gone. And I really want to imprint this on all of you guys. If at that point in time, the pet does not have severe clinical symptoms and is not in pain, try and dissolve first. You can always go in 2 weeks later if nothing is happening. And at that point, abdominal surgery is justified. But really, for the pet's quality of life, for the recovery time, for the cost for the owner, everything that is involved, try diet first. And if diet doesn't help, then go in, send them off to a lab, get confirmed what the stone is, and then start them on the appropriate diet based on that, okay? So will we ever be able to dissolve calcium oxalate? I've already answered this question in a way. Today we can't dissolve it. We need to do surgery, after which we will go over to prevention. And commercial diets, they really aim to decrease calcium oxalate RSS as much as possibly can. And a prospective study in cats has unfortunately not been performed to date. So a retrospective study has actually looked at this. And in this retrospective study, 3 different diets were fed. And you can see that on diet A over here with the dots, well, what you can see here is the percentage of pets without recurrence. So at time point 0, these animals all had surgery, none of them had a stone, 100% did not have recurrence. And the more the line drops, the more stones come back. And over here, you can see the time curves over the course of years. And you can see that on diet A with these dots, it takes on average the longest for the stones to come back. Only 24% of cases recurred, and it took on average 5.6 years. And this was a high sodium diet, or actually more in particular, this was the Royal Canin diet. And these triangles over here is diet C, that's just any other diet. So the pet owner didn't change the dietary strategy. And diet B over here with blocks is actually the UD diet, so a urinary diet from one of our competitors. And you can see that recurrence also is relatively slow, but on both the urinary diet and on any other diet, recurrence was much higher, 59% compared to 24%, and it happened much quicker over the course of 2.1 years rather than 5.6 years. So let's touch quickly on misconceptions in RSS. First of all, sodium and health risks. So of course, many of you might think, whoa, high sodium diets to dilute the urine, isn't this risky? Multiple studies, all referenced here at the bottom of the slides, have been performed. And short studies, 14 days, mid studies, 6 months, and long-term 5-year studies in healthy older cats and healthy adult dogs show absolutely no effect of high sodium diet on blood pressure, cardiac function, and kidney function. However, we do say in dogs and cats with heart or kidney disease, avoid these high sodium diets. Studies in CKD patients have been performed, and there might be some effect of high sodium diets in these particular cases. So don't give urinary diets to dogs and cats with heart and kidney disease, but you can very safely give them long-term to healthy dogs and cats. Another misconception that is quite regularly actually communicated on by some other pet food companies is that if you give increased sodium in the diet, it will also increase urinary calcium. Now, this statement is missing a word because yes, increasing sodium in the diet increases urinary calcium. What does it increase? Urinary calcium excretion via the sodium calcium co-transporter in the urine. But we also know that a high sodium diet dilutes the urine significantly. There is an increase in the urine volume, and this literally dilutes the calcium effect. And actually, on this picture over here, you can see on the left a lower sodium diet, and on the right a higher sodium diet. And you can see on the y-axis, you can see the calcium concentration in urine. You can see a gradual decrease in urinary calcium concentration, which is what matters because it's the concentration that contributes to stone formation with increasing levels of dietary sodium. Then also, you might remember back to the beginning of the lecture when we were talking about the relative decrease in struvite stones and the relative increase in calcium oxalate stones. And one of the hypotheses is that this is due to the fact that we started acidifying our diets in order to get rid of struvite stones. And actually a low urinary pH causes calcium oxalate. Now, this is internal data from our kennel and cattery, so I'm sharing this with you now, but obviously it's not data that we have broadly shared with the rest of the field, so consider yourselves lucky. But what you can see here is the calcium oxalate RSS values plotted against the urinary pH for over 1,600 different samples. You can see that there's absolutely no correlation between the urinary pH and the calcium oxalate RSS value in neither cats nor dogs. And a recently published study by me actually looked at this in a more standardized way. So we fed 4 different diets, and we added to these diets sodium bisulfate to acidify them gradually. And you can see that happening in the urine pH, and you can see that the calcium oxalate RSS does not change whatsoever, whereas the struvite RSS significantly decreases over time. So to summarize, stone risk evaluation is really important in nutrition, and RSS is a validated method that we can lower by increasing moisture in the food, increasing the sodium intake, decreasing the urinary pH, and do targeted dietary minerals and precursors. And really important takeaway messages for you are: high sodium diets are not dangerous for healthy animals. High sodium diets do not increase the risk of calcium oxalate, and acidifying diets do not negatively affect calcium oxalate RSS. So it is possible to address both struvite and calcium oxalate with one diet, such as the urinary SO diet. So let's go back to being a bit more interactive again. I want to go you quickly through a case that you probably have seen in your own practice in the past 2 weeks yourself, a male Bichon Frise called Lucky, who might not have been that lucky. He was 7 years old, castrated, and previously healthy. And in the past week, he started to have difficulties urinating. So he had a weak and disrupted stream of urine. On physical examination, he's very happy, like a Bichon Frise can be. He's very healthy, apart from, of course, significant dental disease like they all have. You do urinalysis, and on urinalysis, you see a urine-specific gravity of 10.42, a urine pH of 6.2, some red blood cells, and other than that, absolutely nothing of significance. No crystals either. And the urine culture is negative, and the blood work is completely normal. You're like, well, that's weird. I don't see crystals. I see a few red blood cells, but other than that, Lucky seems completely happy and healthy. Let's go ahead and do some imaging. So you take an abdominal radiograph, and on this graph, you can see stones, and they are in the location of the bladder. So I'm handing back over to Dr. Pujal right now, because he is going to explain to you what we're going to do next. We are going to ask you some questions to answer.
Thank you, Esther. So, guys, now the next question for you all. So, what do you expect in this particular case? What is your suspect? What kind of a stone or urolith will be? So, is it going to be calcium oxalate, or is it going to be struvite, or urate, or cystine? So your options are in front of you, and you just need to select any one option which you feel is more appropriate. I'm just giving you one hint here, guys. You just need to consider whatever other factors which makes particular animal prone for the infection for these conditions. So do consider the breed and some other characteristics here, what history already Esther shared. And the subsequent question uh, is how you will approach in this particular case. So first we will see what is actually the type of urolith, and then we will take the second question. Over to Esther.
Okay, yeah, so I see I made a mistake because I put urate on there twice. So I think that gave it away that the answer is not urate. Well, what urolith do you expect? Lucky is a Bichon Frise. He is male, middle-aged. He has a relatively acidic urinary pH, and he does not have a urinary tract infection. So to me, everything points into the likelihood of calcium oxalate. And you might wonder, well, why did he not have crystals? And actually, there is no correlation between the crystals that you see in a urine sample and the stones that an animal has. Lucky could have had a secondary bacterial infection and struvite crystals in the urine. He can have no calcium oxalate crystals in the urine. He can have calcium oxalate crystals in the urine. It all doesn't mean anything in terms of predictive value. What tells you the most here why you think it's calcium oxalate is the breed, the age group, the fact that his urine pH is slightly acidic, and that he doesn't have a urinary tract infection. So what do you do next? I know that I talked about my cat Frans and that I felt that he should have had a dissolution trial beforehand. That's because in Frans I was suspecting it was struvite. And Frans also didn't have any clinical signs. Lucky had significant clinical signs. He had difficulties urinating and he was male. So who knows if that is going to go ahead into an obstruction and a life-threatening situation. And you think it's calcium oxalate already. You're not sure until you send it off, but you think so. So the correct answer is that you go for surgical removal. And you get the stone analysis report back. And you can see that the stone was 100% calcium oxalate. You can see different parts of the stone analysis report, nidus, which is the middle of the stone itself, and the shell. And all of them are a form of calcium oxalate. The middle of the stone is monohydrate and the shell is a dihydrate. But overall, the risk factors for both at the moment, as we know, are completely the same. After surgery, you did what you should be doing. You prescribed a dry urinary diet exclusively, but unfortunately, the owners did not come back for any recheck visits. They went off with the diet. They were happy. He was urinating fine again. He's eating the diet happily, no problem. And 9 months later, he has recurrence of lower urinary tract signs. And you say, oh, okay, well, let's just go straight for imaging. And on abdominal radiograph, you can find bladder stones again. And this is not uncommon. This is a study published from 1992. There was no diet information included in the study, but you can see that the recurrence rate in dogs over time is incredibly high. Yeah, at a year time point, almost 40% of dogs can have recurrence. And of course, you can decrease this risk with the urinary diet, but you might not completely be able to take it away. So what could have caused recurrence in Lucky? First of all, the owners might not be feeding him the diet you prescribed. You prescribed a urinary diet, and the owners are like, well, yeah, but he's not actually really liking it. The problem has been fixed with surgery. He loves this brand of food from a supermarket. I'm going to go back to that. The other thing is that he might be getting treats or supplements on top of it. Yeah, so many pet owners give their pets treats, and some treats, such as rawhides, are extremely high in calcium and can thereby, just on their own, increase calcium oxalate RSS value of the urine. So treats need to be really strict, really restricted, and the ideal situation is to not offer any treats at all, or to use urinary kibbles, just literally the diet as the treat, so you could just easily take it out of the allowance of the pet. If the owner swears to you they are compliant, then there are, of course, other causes of recurrence. So first of all, think back to all the way at the beginning of the lecture. For calcium oxalate, we are often only able to achieve a metastable supersaturation zone. It's really difficult to get the urine undersaturated for calcium oxalate. And this means that stones won't form just like that spontaneously. But if you left a very small stone, even just sand size, in the bladder during cystotomy, even on a urinary diet, it might slowly grow back over time. In 9% of the recurrence cases, there is actually suture material in the nidus of the stone. So this is an important one to consider, and that you use suture material that is appropriate for bladder. And I have a nice picture of that here, a stone in which you can literally see, I think this must have been PDS or something like that, very either non-dissolvable or very slowly dissolvable suture material that was used for the bladder. It is also possible, of course, that this stone is completely different than the first occurrence. And then there are animal factors. Lucky might have developed hypercalcemia because of malignancy or anything like that. And diet only decreases the risk, but if Lucky becomes hypercalcemic for some reason, then you have a problem at hand, no doubt. Oh, here you can see another stone, by the way. You can really nicely see that the suture in the middle has dissolved, but it was there originally. So this brings me to the end of my lecture. I don't know if there are any questions from your side. I think Dr. Verschaal is collecting those, so maybe he can share any that you have.